So welcome. We're very, very excited to be with you all today. My name is Sue Grinnell, and I am with the Public Health Institute and the director of the Population Health Innovation Lab, and get to work with these two amazing people that are with me today. So Stephanie Bultema, who is our research scientist and co-principal investigator on this project, and Christina Olson, who is a program associate and who hails most recently from Imperial County, California, ACH. So we're very grateful to have her and her background. It's very helpful. So, you know, who's with us today are people from all over the US. So that's very exciting to us because we really are looking to create a space for learning in this world. So we'd just love for you to take a moment and put your name in the chat and where you're from. And then just like, what would you choose to spend the next year of your life in a library or the next year of your life in a museum? Like which would be funner for you and why? So just take a moment to go ahead and do that. Just having some fun. Yes, I always wanted to be a librarian. That's kind of a secret. Yes. Oh. Huh. These are great. Oh, the museum movie. Yes. Wasn't that Ben? Was Ben Stiller in that? I think he was. Lovely. That's great. Well, very fun. I like that. Great. Lots of museums and a mixture here, right?
Josh, I like your museum library.
What did he say?
He said a museum library.
I want to cover all my bases.
Yeah.
So a museum library seems the way to go.
I think I'll move in with you, Josh.
That's right.
Awesome.
Oh, very, very good. Okay. Well, thank you for just having a little bit of levity. I've had the opportunity most recently to be talking to a lot of ACHs. And one thing I found very interesting is fun. People want to have fun. Like, you know, that, you know, create spaces for fun as well as learning. So, you know, there's a little bit of fun here today. Okay, well, good. So just a little bit about us as before we dive in. So we are the Population Health Innovation Lab, and labs by their nature are strategies to address complex problems. And you do that through a variety of different ways. And we really are about supporting the success of multi-sector collaboratives and in particular backbone organizations. And, you know, for us, it's what can we do to really support their success to advance health, well-being, and equity in their communities. And today you're going to hear about one of our projects that we're very, very excited about. Next slide. So we recognize that there may be some partners who are with us today that aren't familiar with this model of an accountable community of or for health. And thanks to our partners with the Funders Forum, we are borrowing their slide that just shows some of the elements that are in most of the ACHs. As we know, it isn't in every state, and the state that do have them, there might be some differences, but typically these are the pieces. The one piece I love that's on here is continuous learning. I think one thing I talk a lot about with communities is just incorporating time for reflection, because you're so busy going, you don't spend time learning, right? Like about what is it that's really happening. So can we move next slide. So before I turn this over, I just really want to say it does take a village in doing this work. And we have lots of amazing partners that we're doing this, as well as funders. So we're very, very grateful for the funding for this project from the Robert Wood Johnson and working with the Georgia Health Policy, who actually is funding us for this. And all of the other partners that are on this, we could not do this without you. And in particular, a shout out to the ACHs that we are partnering with to learn from in California and Washington. What we're going to be doing today is sharing a little bit of background on this project. And this project is a 2-year grant. So we're not even a full year in yet. May will be our first year. We're going to share emerging findings. So what we're trying to do is not wait till the end and create a report that sits on a shelf, but to share the information now and have you engage with us really in the learning to say, are we learning the right, what are we missing, or what does that really mean? And then we're going to have some times for reflections and discussion with you all. And I think that Christina put some things in the chat that are links that are supporting documents. And then for those of you that just joined, we will be sharing the slides and the recording when we're done. So with that, I'm going to get out of the way and turn it over to Stephanie.
All right. Hi, everyone. It is my pleasure to share with you what we have been learning so far. So as Sue mentioned, we are 10 months into this project. It's a 2-year project. So we're really just starting to kind of wrap our heads around what we're learning, but it is an honor to get to share this with you as we're going. Since some of you might not be as familiar with this project, I want to start off with just providing a very high-level overview of what this is that we're talking about here. So we have, in our just kind of short way, been referring to this as aligning systems for health with ACHs. But this project is really exploring how collaboration and alignment among public health, healthcare, and social service sectors, but in partnership with community residents and tribal nations, leads to outcomes in 22 ACHs across Washington and California. If you look on the left-hand side of this slide, you'll see how each of those ACHs are positioned across those 2 states. I will also mention that this is one of 7 large research grants that is conducted through the Aligning Systems for Health Initiative with support from the Robert Wood Johnson Foundation and leadership from the Georgia Health Policy Center. So we are extremely grateful for all of the amazing support that we get from these partners. So this project is kind of anchored around 2 big research questions. The first is, how can elements of an ACH's local context, core components, and adaptive factors be combined, enhanced, or mitigated to increase the likelihood of achieving effective outcomes? So the outcomes we're most interested in are at the bottom of the slide. They include cross-sector alignment, long-term sustainability, and improved health equity. I also want to mention that you might not be familiar with some of these terms like core components and adaptive factors, but I'm going to talk more about those in just a minute, so this will all come clear. But the second research question that is guiding our inquiry here is, when do certain configurations work, for whom, why, and under what conditions? We acknowledge that every ACH, indeed every multi-sector collaborative, is different. We are not going into this research project with the assumption that what works for one community will automatically work in every community. And so we are intentionally getting to that level of granularity to figure out what will work across different communities. So I do want to start off by introducing you to the framework for aligning sectors. In addition to those research questions that I just shared with you, one of the main goals of this project is to contribute to the development of the framework for aligning sectors. So this framework is currently being developed by the Aligning Systems for Health team at the Georgia Health Policy Center. And we're everything that we're doing in this project is contributing to refining this, advancing it, and helping to get this to a place where it's really reflective of what ACHs and other multi-sector collaboratives are dealing with when you're out there trying to align efforts across sectors. So I'm just going to provide a very quick overview of this framework. I do want to give Daniel and others from Georgia Health Policy Center a heads up that I will be asking you if I miss anything after this. So if you know anything that is important to call out that I did not call out, please be ready to hop in and let me know. So starting off here, we see that in this framework, we're really focused on 3 sectors: the public health sector, healthcare sector, and social services sector. And we're focused on how these sectors, how organizations across these sectors come together to eventually produce the outcomes way over here. But there's a lot of stuff that happens before you get to those outcomes. First and foremost is the local context. So down here, you see that surrounds everything else in this framework. And this is huge. This is demographic characteristics of a community, the socioeconomic conditions of a community. This last year, this is living during a pandemic or acute attention paid to race and racial issues, to systemic racism. And so all of these things in a community's local context affect everything else in this framework. But let's hop right into the center of the framework here. So remember, in that first research question, we talked about core components and adaptive factors. So here's where you see that. These darker blue cogs in the center: shared purpose, data, governance, and financing. These are elements that we acknowledge are, or at least we believe and acknowledge, are critical components for any aligning effort. For any community that wants to align across sectors, we believe that these things must be in place and they must be strong. But we're also learning that there are all of these other things: community voices, equity, power dynamics, trust. We call these adaptive factors. There are all of these other things that are interwoven amongst these core components, and they affect each of these core components and whether or not communities are able to achieve these core components to the levels that are needed to achieve outcomes. So we're really understanding that there's a ton of interplay between all of these different elements within an ACH or similar multi-sector collaborative.
That is fantastic.
And then ultimately, once these adaptive factors, the core components, they interact, and eventually they produce changes in mindsets, practice, and policy. And these changes are kind of the mechanisms that get us to the end goals. So shared progress towards specific community goals and needs, toward progress toward health equity, racial equity, or we're also looking at alignment as an outcome or sustainability as an outcome. But ultimately, all of these things, these adaptive factors and core components, are critical if we are to get to those end outcomes. So I want to pause here and ask, Daniel, I believe Karen's on here, anyone who knows a lot more about this framework than I do, is there anything else that you want to add that you think is really important for people on this call to understand about the framework for aligning sectors?
It was nice to hear you sharing it with such enthusiasm.
I'm glad to hear that. Thanks, Karen.
Hey, Stephanie, it's Glenn at the Health Policy Center. The only thing I would add, and you did a great job describing it, is that it's less important for people to say, "Oh, are we aligning correctly or not?" Less focus on alignment as a noun and more focus on aligning as a verb, and that's what our project is trying to do. I think that's what you all are trying to do, and that has evolved over time. So just over the past year or so, that we've recognized that shift because it's sort of about the way these sectors are going down this path together in new ways. That's the most important thing, not whether or not we're aligning perfectly.
Yeah, I super appreciate that, Glenn. And I appreciate that the language is shifting to aligning versus alignment, because that also speaks to the ongoing dynamic nature of this effort. It's not like you can say, oh, yay, we've achieved alignment, we're done. And now that we've achieved alignment, we can just sit here and be happy in alignment, because it's something that, as you all know, requires constant effort, constant maintenance. It's an ongoing process. And I like, Glenn, that shift from alignment to aligning is reflecting that it is an ongoing thing that will always require some level of attention. All right, so now let's dig into the emerging findings, what we have seen so far. But I want to start off by framing some of these findings and just level setting what you're going to see today and what you will not see today. So today you are going to see a project status update, kind of where we're at, where we're going. We're going to start to paint a picture of what we've been seeing over these last 10 months. And we're also going to be describing what we're seeing in alignment with the framework for aligning sectors. And so hopefully you'll gain a little bit better of an understanding of this framework by the time we're done today. But I think it's equally important to share what we're not going to be doing today. We are not today, nor any day, going to be comparing ACH to ACH, nor state to state. That's not what this is about. We are trying to learn what ACHs are doing to create this alignment, to do this process of aligning that we are seeing so wonderfully carried out in communities. Today, we're not going to be sharing inferences, nor drawing conclusions, nor offering recommendations. Those are all things that we will be further
There's
developing.
somebody on this webinar that I met a long time ago.
And working with communities to really move this research forward. And so today you're just going to be seeing more of kind of a broad landscape of what we're seeing. So I want to start off by sharing a little bit about the data that we'll be drawing on today. There are two primary data sources that we'll be referencing a lot throughout the slides today. The first is the interviews we've conducted so far, which have been conducted with 30 individuals representing 15 ACHs across Washington and California. And we'll also be drawing on survey data. We are drawing on two different surveys, one that was conducted in Washington and another that was conducted in California. And you will notice over here on the right, and I think this is important to note, that the results that we're sharing today are more representative of Washington State, ACHs in Washington. So just keep this in mind. And also, I want to say before we start hopping into specific measures, that there are some questions that we only asked in Washington. And so there will be some measures that, I'll say, oh, we saw this across states, and others where I'll say, we saw this just in Washington, since the surveys were slightly different. But we did ask several questions, many questions that were the same across the two surveys. But just a note before we hop into what we're seeing. So let's start off with the far left-hand side of this framework, our sectors, public health, healthcare, and social services. So here we are looking at a cross-sector representation that's a little bit broader than this, just those three sectors. We're also considering ACH staff kind of as an independent group, community voices and as an independent group, and also tribal nations and tribal services. And so over here on the right, you'll see just kind of a nice representation of how many people of each group are represented in what we're talking about today. And you'll see that the healthcare sector and the social services sector are the best represented in our data. So they are the most, our data, what we're sharing today, are the most representative of the healthcare sectors and the social services sector. Now let's hop into local context. So as I mentioned, local context is huge. There are so many different things that we can talk about when we talk about local context. So what we chose to zoom in on today is specifically COVID-19 response and systemic racism. These are two things that no matter where the ACH is positioned across these two states or a multi-sector collaborative is across the country, these are two things that have affected every single community during this research project. So this is where we'll focus just a little bit of attention today and in our research as we progress. So starting off with COVID-19, one of the things that we heard in interviews was just the amazing way that ACHs have stepped up, leveraged their existing partnerships, and been just amazing partners and support systems for communities as they've had to grapple with all of the consequences of the pandemic. We've seen that ACHs have stepped up to help distribute masks, that they have stepped up to help support their local health departments, that they have reached out to communities to see what kinds of resources, health or social services or whatever people need. And they have gone out of their way, they have repositioned, pivoted, and been there to support their communities. So I've loved hearing that in interviews. From a quantitative perspective, in the survey, across states, we saw that 66% of respondents said that their local ACH strengthened their community's ability to respond to COVID-19 and its consequences to a great or moderate extent. So we've heard from both the qualitative and quantitative perspective that ACHs have just been a key core component in their communities in dealing with the consequences of this pandemic. One of the other things that we have heard over and over again in interviews is that not only is systemic racism a problem in these communities and has always been a problem, but that COVID-19 has shined a huge spotlight on systemic racism, that it has uncovered many of the inequities and exacerbated the inequities that already existed in communities, and now is just, they're growing wider because of the challenges that communities and people are facing as a result of the pandemic. And so as kind of a starting point, we wanted to see where communities are and how they think about systemic racism. You know, a first step is just assessing the problem and seeing where people are at. So we only ask these questions in Washington, but you'll see that in Washington, the majority of people, the vast majority of people strongly agree that systemic racism exists and that it's a problem in American society today. But we saw to a slightly lesser extent, still most people, but lesser than what we saw in the previous and systemic racism just belief and American society, we saw that 70% of respondents strongly agreed that it's a problem in their local community. So a little bit of a difference there between the local and the national level. The next thing we're curious about is how people feel about the amount of attention that is paid to race and racial issues, both in the country and in their community. And what we saw was that there are pretty low levels of people thinking that it's about right. So in Washington, 13% of survey respondents said that they believe the amount of attention paid to race and racial issues in our country, in the US, was about right. Whereas that was a little bit higher when we looked at the local level. So 21% of people said that the amount of attention paid to race and racial issues in their community was about right. But I also want to call your attention to this dark blue ring or portion of the ring here, where we saw that the vast majority of people said that they think there's too little attention paid to race and racial issues in our country and in their local community. So now that we've talked a little bit about local context, because again, local context affects everything else that happens in ACHs and other multi-sector collaboratives, let's dig into the core of this framework a little bit more. And I do want to preface this.
Stephanie,
yes.
Sorry, I'm thinking because you did some explanation, right, of why Washington questions and California are different. There's a question coming up just in terms of why. just why the questions were only asked in Washington.
Yeah.
Yeah.
That's a great question.
Sorry for interrupting. I just.
No, that's a good question. And it's actually, this is a timely point to share this, because I'm about to get into more things that are like in Washington versus across states. So in California, the CACHI folks have a wonderful evaluation program that is in its 3rd year, I believe. And every summer they administer a partner survey. And one of the, we're working very closely with our partners to make sure that we're conducting this research in a way that is useful for communities, and also in a way that is not getting in the way of the great work that's already being done out there. And so early on, just when we were, initially planning this, we were working with CACHI and the CACHI evaluators to figure out, okay, how are we going to do this in a way so it is really leveraging the great work that they're already doing without getting in the way of that. And so fortunately for us, the partner survey is what the survey is called, already had a lot of great stuff in it about these core components and adaptive factors and outcomes, the things we're really interested in. And so what we did was establish a data sharing agreement with CACHI, so that instead of asking everyone in California to take another survey right after they did the evaluation survey, we worked closely with the CACHI evaluation team. They were kind enough to let us add a couple of questions to the partner survey. We then adapted as many questions as we could from the partner survey to use in Washington, so that we'd at least have a subset of questions that were the same across states. But then in Washington, we worked very specifically with the Washington ACHs, and I believe that Celeste and Gina are on this call. They were amazing champions in helping to get the Washington survey fine-tuned. But so it's really because we took a different approach in both states out of respect for people's time and what is already going on in those states. So that is, I hope that answers the question that, is really just a matter of practicality.
Thanks so much.
Yeah, for sure. So let's dig into these core components. Again, these are the things that we believe must be in place for an ACH to function and achieve its end goals. So overall, we saw that there is an extremely high level of shared purpose among ACH participants, which was just amazing to see. We saw some different indicators of where people are at with data, governance, and financing, with a little bit more mixed results. But actually, before I hop into these specific measures, I want to make sure to say that we, as part of this project, we're going to be digging into how best to measure these big ideas. So when we talk about shared purpose or financing or equity, those are really big ideas that you can't encapsulate in a single measure. And so what we'll be doing is taking these multiple measures that we have for each of these concepts and start to figure out how can these measures be reliably combined in different ways to really get an accurate picture of what does shared purpose look like in a community, or what does financing look like in a community. But that's something we'll be doing down the road. And so today, I'm really just going to be focusing on one measure for each of these big ideas. But just know that as we move forward, we'll be taking a more kind of comprehensive approach to how we're looking at these big ideas like shared purpose. But let me hop back in here. So in Washington State, we saw that 91%, so almost everyone, said that their objectives align with the ACH's goals. Really cool to see, especially since, consider that includes tribal representatives, community residents. And so just to see that across sectors and in the community and in sovereign tribal nations, people are saying, yes, we're all on the same page. I love seeing that. From there, we saw that just over half of respondents across states, so in both California and Washington, said that their ACH regularly shares data and progress reports with community, clinical, and tribal partners. We believe that's an important indicator of data capacity. From there, in Washington, we saw that 72% of respondents agreed that they understand how decisions are made in the ACH. Again, we believe this is a really important indicator of how well governance is playing out in a multi-sector collaborative. And then finally, across both states, we saw that just under half of ACHs, or of ACH respondents, said that they are far along with identifying the financial resources needed to sustain the work of their ACH. So now let's dig into the adaptive factors. And remember, those are these kind of softer elements that are interwoven among the core components and that have interplay with one another and the core components themselves. So these include community voices, equity, power dynamics, and trust. And I've been really excited to see here that, and this is, of course, has been reinforced in the interviews, but in our survey data, we saw that ACHs are keeping equity at the center of their work. We've seen in Washington, and I'm sure in interviews we've heard in California, that ACHs are shifting power dynamics in their communities, not only between sectors, but also in empowering community residents to have a more active role in the community and a voice in what's happening. And then we also saw that there are super high levels of trust in ACHs, super cool. One of the areas where we've heard ACHs are really trying to figure out how to be more effective is when it comes to including community voices in their work. So across the two states, we saw that just under half of survey respondents said that their ACH is engaging residents who represent the community to inform its work to a great extent. Now, returning to equity, we saw that across states, 86% of respondents agreed that their ACH applies principles of equity, diversity, and inclusion throughout its work. These kinds of indicators of procedural equity, we believe, are really important for getting to long-term equity outcomes. When it comes to power dynamics in Washington state, we saw that 87% of ACH staff and community residents, it was only asked of these types of respondents, said that their work or engagement with the ACH has influenced their sense of power to change or influence their local community. So like that just makes, personal bias, that just makes me really happy. And then trust. We saw that across states, almost everyone said that most ACH participants are trustworthy. There's a high level of trust across these ACHs. So one of the things I want to close on before handing it over to Christina, who's going to share what we've been seeing around some of these outcomes, is I want to make this linkage abundantly clear for you all between local context, the core components, the adaptive factors, and outcomes, and why it's so important to understand local context, core components, and adaptive factors. The reason here is that all of these things, they are what generate the actions that contribute to outcomes. Without understanding which core components are most important, which adaptive factors are most important, how local context affects everything else, without understanding those processes at play in ACHs, how people actually do the work on the ground, they're like, we just don't have the same capacity to use evidence to get to the outcomes that we're trying to achieve. And so ultimately, we believe, and past research and theory shows, that if we can better understand which of these elements are most important and in what combinations and doses for each of those elements, we will increase the odds of achieving our goals. And so ultimately, our goal with this project is to get a better understanding of how these different pieces in the heart of the framework interact and which things are most important for achieving those long-term outcomes that we might not see changes in the population, at the population level. We might not see changes in the data for 5 or 10 years down the road. And so being able to understand how to measure progress along the way, and also being able to understand which of those elements are most important to focus on and in what ways, We believe that will be beneficial for ACHs in Washington, in California, across the nation, and hopefully for other multi-sector collaboratives as well. So now that we're hopefully all clear on that, I want to hand it over to Christina, who's going to share some of the really cool stuff we've seen around the 3 outcomes that we are most focused on in this project.
Hi, everyone. So thank you so much. We're excited to share a little bit more on the qualitative side of things. Stephanie has really given you a rich context of what we're starting to see emerge through some of the survey information that we've been collecting. But as she mentioned in the beginning, we've also been doing some preliminary interviews. And so most of the information that I'll be sharing now has been drawn primarily from those interviews and has been shared with the sites, both in Washington and California, through open space discussions where we've tried to really provide value and bring these opportunities to discuss what we're seeing. So that way they can say yes or no, this doesn't or doesn't make sense. And we can really talk kind of cross-state, cross-community about why these things are happening, what other things are needed, and really just trying to gain that engagement with them in the short term as opposed to waiting till the very end. So let's see. Oh, Stephanie, can you advance the slide? Okay, so we're going to be talking first a little bit about alignment. So as Stephanie and Glenn mentioned, this is really probably more of a verb than a noun because it's much more of a constant process of aligning as opposed to alignment and you're done. So what we're seeing and what we're hearing from the ACHs is that they are playing a critical role in their communities around creating alignment and a shared vision. They are convening partners across boundaries, sectors, tribes, cities, counties. They're also facilitating partnerships within and across these boundaries. That is all working to help strengthen collaboration between community, clinical, and tribal partners. It's also helping to improve the care coordination process and improving referral network systems. As you can see here, some of the people that are stating this are saying that really alignment is at the core of the work of an ACH. Without this work is not possible. And this is what really will be sustaining and outliving any sort of medication transformation project or these different types of funds that are currently in the works that have made this happen. Next slide. So again, we're also talking about equity. One of the things that we heard from ACHs is that this was not necessarily at the foundation of all ACHs. And I think it's important to draw that out because some, every model is different. Both California and Washington have different models and origins of their ACHs. And we have heard that equity wasn't necessarily a focus. It may not have been a requirement in the same way for both of these different communities. So it wasn't necessarily required in deliverables or measurables. And so people started equity work in a different way. And even though that's true, what we have heard from partners is that everybody is now starting to think about equity, even if they didn't begin that way. One of the things that people are realizing is that in this change of systems, in this work of collaboration and aligning, this is equity work at its root. And so that's been a really important realization for a lot of the communities. And in talking about equity, I think there's been a lot of discovery around some basic foundational level needs to even be able to do this work, such as awareness and language to talk about equity as an issue. That has been a big barrier for a lot of communities, how to even bring this up. You also need buy-in from leadership to put equity at the forefront of your work. That is a challenge in and of itself because there are communities that have expressed that people don't believe racism exists in their community. Sometimes that's at a leadership level, and that's really challenging to overcome. We've also heard that relationship and trust building amongst partners to allow for conversations that may challenge one's current perspective is critical for equity to progress. We also hear that inclusion of community voices is absolutely necessary for this. As people have dived into equity work at a more in-depth way, we've also heard that there's a lot of challenges in terms of addressing equity. Some of that, as you know, we've already gone over, is the language and the buy-in, but also the tools. How do you measure equity? How do you account for these long-term huge outcomes in a short-term space? And how do you keep partners at the table for equity work when they aren't seeing that big needle move? Also, how do you clarify and balance measuring requirements versus equity progress? As I mentioned, there isn't necessarily always an entity saying you have to do equity work and show me that you're doing it. So really trying to work that in as an important factor can be very challenging when it's not in the report. As well as people fall within how to engage the people that are falling within the equity gaps. As you've probably heard in many different initiatives that are heavily focused on changing our system, community engagement is absolutely critical. And it is one of the most challenging components for many communities to really figure out how to do that meaningfully and to do it on a regular and consistent basis to integrate into the work that they're doing. Next slide. But what we're really excited about is that with this equity work with the communities, we are seeing progress in a lot of different ways. And so one of the things that we did for one of these open space conversations was kind of map some of our observations around equity work onto somewhat of a social ecological model. So you'll see things happening at a policy level, like tying percentages of funding with partners to pay for equity measures. At a community level, you're seeing cross-sector conversations to identify community-specific equity gaps and goals. At an organizational level, people are ensuring measurement of and analysis of equity data in their work plans, or they're building possibly equity accountability councils into the infrastructure of their ACH. And I also want to note that because we mentioned equity work really requires language and understanding, we're also hearing a lot of ACH partners talk about the interpersonal and the individual level work that has to happen on their own in order to even engage in this larger level work. So they might be having conversations in book clubs with their staff members or doing their own homework at home to really better understand equity and how they can bring this to the forefront of the ACH. Next slide. We'll also just dive very briefly into sustainability, but sustainability is probably one of the golden $1 million questions for absolutely every ACH. And one of the things that we're talking and hearing about from the ACHs is that they're thinking dynamically about sustainability. So of course, there's the economic factors, the financial resources that are needed to pay for the day-to-day operations and demonstrating value add to the overall community and partners. But people and ACHs are also thinking about sustainability in terms of social factors. So staff and participant commitment and levels of community engagement and political support in this work that's needed to really move it forward in the long term. And one of the things that I want to mention too is I think in line with what Stephanie said earlier, this really is a challenge for ACHs because right now, a lot of the communities that have been involved in this work for even a number of years are saying we are seeing change and we're seeing great things that are more soft outcomes like building trust and improving collaboration and coordination. But that's so hard to measure. And we're not really seeing funders that want to fund this specific type of work. So that's at kind of the core of some of the issues around sustainability that people are experiencing on a day-to-day. Next slide. Partners are also thinking about what to sustain. So as I mentioned, there's the social and the economic factors that are at play here, but partners are trying to analyze what has really been of value to their local community. And that looks very different across ACHs. So in one community, it might be the backbone organization really upholding the work, and that is of value to them to continue sustaining and financing in the future. For others, it might be newer, improved ways of working and new programs. For some of them, it's infrastructure and referral systems. And for most people, it is the relationships. We have heard so strongly that the relationship building, the trust building, the breaking down of the silos that has been done through ACHs has just been absolutely pivotal. And that is definitely something that everybody seems to want to sustain in the long term. Next slide. We've also seen a few emerging models around sustainability that's exciting. Some people are thinking creatively about creating a founding members fund where they're having annual contributions of ACH partners into a pooled fund that's supposed to support the backbone for their future needs and uses. We also have partners that are really thinking about a fee-for-service type of model where they are creating a center of excellence, or they're generating a revenue generating arm that can actually meet the needs of local community partners through trainings and services, and then using that to fund the ACH work. Yet others are partnering with Medicaid health plans and doing a fee-for-service or serving as kind of a one-stop shop for health plan needs, such as meeting the social determinants of health. So there are exciting things that we're seeing emerging from communities. And I think one of the things that we have heard is that sustainability will be different in all of these areas right now as it is, just given the nature of where people are and the context that they're in. And so everybody has different needs, and it's exciting to see these different emerging models based on kind of those different contexts. Next slide. Now, one of the things that we've also heard from the sites that have kind of started to build these emerging models is that there are some themes in terms of how they got to that point. The first is that they've taken advantage of opportunism. So many of these sites ask questions like, what changes are happening in my community right now? Where is there unmet need or emerging need? If my ACH can fill one of those things, does that align with my ACH work? And then once it's filled, who benefits and what changes? They're then using that opportunism to talk about what they can measure. So what levers of change is the ACH actually pulling in the work that it's doing? And what is the impact of those levers? And when you pull those levers, who benefits? And can you get paid for those services and the changes that you're making? Finally, we've seen that persistence has been absolutely key in all of these in groups that are creating a sustainability model. There isn't a single approach. And for most of these ACHs, it's taken a business-minded entrepreneurial leadership effort that really pushes through these boundaries, even when people around them and their partners don't fully understand the long-term benefit of what they're trying to do. There's also one of the things that we had mentioned too, that we have been working on putting theory into our work here, and we have integrated that. Stephanie mentioned that previously. And so I won't dive into how people are sustaining, but we have also integrated theory, and we're seeing great progress in terms of how people are building their governance bodies and structures to create sustainment for long term. So Stephanie, I will turn it over to you.
And I'll actually turn it over to all of you to see if, so next we're going to, if we have time, we're going to share just some emerging reflections that we're having and just some next steps where we're headed next. But we wanted to pause here and see if there are any burning questions at this point before we close out and hopefully save a couple of minutes for discussion at the end.
Hi there, I've got a couple questions.
Let's hear them.
Well, how about this one? So, especially with the survey, Stephanie, there are all these people. There's hundreds of folks that are taking these surveys, and they come from different backgrounds or different kinds of folks. Did you ever see any interesting splits around, like, so we had numbers on like how many people felt one way and how many people felt other ways about different things, but did you ever see any like splits like that might indicate, you know, in some places or some reasons why people would feel differently?
Yeah, I love that question, Daniel, and I'm really excited to dig into it because our very first priority with analysis was generating reports to give back to ACHs to make sure that they were the first ones to benefit from the survey results. We haven't had as much time to dig into these types of big questions as we'd like. So I will definitely make note of that, and I'm excited to dig into it more, and I'm excited to share with you what I find. But so far, we're just not that far into digging into the depths of the analysis to be able to answer that question right now. But that's what we're doing right now. So I'm excited that maybe even as soon as tomorrow, I could answer that question for you.
Thanks, Stephanie.
Yep. All right. Well, in the interest of time, I'm going to go ahead and move us along. Feel free to put any questions in the chat at any point. Hopefully we'll have a couple minutes for more questions and reflections at the end. But I also just want to let you all know that we love working with you all. We're excited about this work. And so if at any point you just want to find a time to chat with one of us on the team and talk through any other question or any ideas that you have, we would so welcome your outreach. So we'll, as Sue said, share these slides. We have some contact information in here. So this conversation does not end here today. So we're happy to continue it with anyone who wants. So I'm going to spend just a minute on one emerging reflection we've had as we've been going through this research. And there are many we could have chosen, but we decided to focus on this one because it is the most relevant to what we're talking about here with the framework for aligning sectors. And what we have noticed so far is that this idea of aligning across sector that only includes healthcare, public health, and social services can be really limiting. It can be limiting in measurement, how we talk about things, and more. So just to give you a sense of how I think about it, how I see it in my head, this is when I think of all of the sectors that we're talking about here, public health, healthcare, social services, this is how I think about it and how I see it. Like, okay, we have public health up here in the left-hand corner. We have healthcare down here, and then we have social services, this huge bubble over here. And social services also includes local, state, and federal government, how we're conceiving of it. It also includes businesses, which doesn't always feel right. And you know, it includes education, and the list goes on. And so this question of what all fits in social services can get messy. We also have done here that the sovereign tribal nations, these are sovereign nations. They're not sectors, they're not organizations. How do they fit into this work? Because we, or at least I certainly do, and I know many ACHs feel this way, that tribal nations must be involved in the work of transforming health systems and aligning sectors if we're to really create the kind of equity that we want to see in communities. And so some of the kind of specific things we're wondering is, how should tribal nations be honored, respected, and invited to participate in these aligning efforts? Where do governments, governmental public services, and private businesses fit into this work? Because I'm definitely not going to say that local employers don't have a role in aligning sectors for health. I believe they do. And then when we get to social services, how do you represent the diversity of types of services and the expertise that's brought to community health systems by social services? Transportation is not the same as housing, is not the same as food security. All of these different types of social services bring unique qualities to this work. And especially as we enter this next phase of data collection, which is really focused on power dynamics between sectors and between individuals, between organizations, I can't help but wonder if it is a disservice to the social services organizations to lump them all into a single category, and whether or not this is potentially even reinforcing power imbalances among the sectors and among organizations and communities. So if we have time, I would love to hear, especially from the ACHs on the call, how your ACH approaches this question of sectors and how you incorporate all of these various perspectives into your work. But before we get there, I'll just close us out real quick with where we're going next. So our research plan is that next up, we are going to collect our remaining primary data. We're going to be working with 8 ACHs across Washington and California to do deep dives and get a really close look at an understanding of what's working for who, when, why, and where. So again, based on that assumption that what works for one ACH might not work for another ACH with a different context. We're going to be collecting our remaining secondary data. So we're doing an extensive review of historical records and documents, as well as tying what we're seeing in our primary data to population health and demographic data. We'll be working to finalize our findings. So we'll be analyzing and triangulating our quantitative and qualitative evidence. We'll be digging into the analysis in much more depth and answering great questions like Daniel brought up. And then we'll move into sharing our findings, which we'll be doing in partnership with communities. We'll be working with ACHs and others to translate our findings to conclusions and implications for practice. There are several different ways we're putting findings to use. We have been working to develop a national ACH community of practice, so I'm excited that we'll have many more opportunities for ACHs to engage in this in the coming years. Phil has just created this amazing, at least I think it's amazing, curriculum for multi-sector collaboratives. It's called Powering Change. There will be a web discussion focused on the Powering Change curriculum next week. I hope that in the follow-up we'll mention this so you can check it out. We'll be hosting some workshops with ACHs that are focused on how to put these findings to use in their ACHs. And then also I'm excited that we'll get to do a little bit more work with the Georgia Health Policy Center and Robert Wood Johnson Foundation to really contribute to a toolkit for how to measure some of these aligning concepts. So that is, let's see, that's what I got for you. I do just want to make sure that you all know that there's this toolbox slide that will be in here for you to check out at your leisure when these slides go out. And then let's see, in the last 3 minutes that we have left, I want to see if there's a burning question out there or other reflection or idea that anyone wants to share.
You know, Stephanie, Gina has a comment in here, and I know we have a slide on this, but we ran out of time just regarding how public health departments and ACHs are working together. And I know Gina, with being from Seattle, King County, right, that's a focus. But yeah, anything you want to say?
I would love to say so much about this, Gina. This was actually one of the other reflections that we had slides in for, and we realized we're not going to have time for all of this. Yeah. This is something I don't know how, but I would love to dig into more, because one thing you might have noticed at the beginning is that public health is so underrepresented in this research. And we have big questions about why is that? I mean, certainly the pandemic is at play. But you know, I come from a health district. I come from a local health district. That's kind of my background. And so I've seen some of the things at play on the ground between ACHs and public health departments. And I suppose all this to say, Gina, I am very curious. I personally don't think that they are duplicative. At least they don't have to be. I believe that there's a lot of potential for mutual value add between ACHs and public health. I say this as someone who has worked very closely on the ground with ACHs and public health. But one of our big reflections is that we're seeing some kind of concerning stuff here. And that might be too strong of a word, but I would love to dig into this question more, Gina, and you're spot on with it. I don't know if that was satisfying, but that's what I got for you.
Thank you.
Yeah. All right. Well, I think we have
one more. We are at time. Yeah.
So Sue, would you like to close us out?
Sure. Well, thank you. It seems like there's no shortage of information to be able to share. And so thank you so much for joining us. We are very, very excited and so grateful that we have this opportunity to work with you to further the practice. And so we will be sending out the recording and the slides. And if you have any follow-up questions or random, like, oh, I'd just like to chat, we love to chat. So let us know. So thank you so much for joining.